An infectious disease specialist, Dr. Isaac Bogoch. For more, he is also a member of Ontario's COVID-19 vaccine distribution task force and joins me from Toronto today. Doctor, always great to speak with you. I want to start with your take on what the medical community has said in this letter to Doug Ford and how you hope he'll respond.
Right. So it's clear that most, of course, not all, but maybe I'll say many in the medical community feel that schools can be reopened safely on a regional basis. We know this is a massive province. We know that the burden of COVID-19 is not equally distributed throughout this province. There's some areas where this can be done in a much safer manner compared to others. I think it's fair to say that the regional medical officers of health know the areas they represent best, not just with the school factors, but also with local transmission dynamics, other social determinants of health that may be affecting the populations they represent. And I think that can be a very regional decision. Of course, this is a contentious issue. Of course, some people feel strongly on both sides of the issue. Personally, I think this is a very reasonable response to have a regional reopening of schools.
Right, and of course in Ontario, the second dose interval for vaccines has been moved up. So there is the expectation that more Ontarians will be vaccinated sooner. But it is still the case that a lot of teachers, some still waiting for their first dose. Many, of course, don't have their second dose. Is that a consideration in this?
I think it can't be ignored. It certainly can't be ignored. It also can't be ignored that, there were schools that were opened up before we started vaccinating anybody, before anybody had a dose of a vaccine. It's also fair to say that some people got COVID-19 in schools as well without that. We know that one dose provides very reasonable protection, but of course it's not perfect. You still need 2 doses of a vaccine. But of course, vaccines, masking, ventilation, physical distancing, these are all interventions and measures that can be taken that have an additive benefit and provide better safety. Not everywhere is prepared to do this. There might be some places where they're going to say, you know what, the community burden is too high. It's not reasonable to open schools for 3 or 4 weeks. Other places will say, listen, we've had, we're getting 0 to 1 case per day in our area. We've got a first dose of a vaccine in teachers. We can do this safely, and they might choose to do so. So, I think we just have to treat a massive province with different burdens of COVID-19 throughout as take a very regional approach to this.
Now, I did want to ask you about variants of concern because, of course, that is a topic that is still quite a real concern at this point. One of the epidemiologists we spoke to earlier said that's one of the ones that he's worried about, is specifically the variant that was first detected in India in the cases that we've seen here in Canada. Are you concerned about those variants, and how protected are we once we do have our vaccines?
Right. So you can't ignore this. This is very important to look at. And, we're watching this variant spread in places like the United Kingdom, where they actually have very high levels of vaccination. Now, when you dive a little bit deeper, it appears that this is spreading primarily among unvaccinated individuals. And based on preliminary early data, it appears that the current vaccines that we have in Canada are still effective. What's interesting, though, is that a single dose doesn't provide the same degree of protection that it would for example, non-variant infection. So it's really important to get those 2 doses in. That's why I'm pretty happy, at least from a Canadian standpoint, that we see the provinces really mobilizing their second dose strategy, and that probably in the next 2 months, many Canadians, especially high-risk Canadians, people at greater risk of having a severe outcome, will have had their second dose. That's the way to do it. We've got to really get those second doses in fast. But the early data does appear that these vaccines will protect against these variants.
All right, that's good stuff to hear from Toronto infectious disease specialist, Dr. Isaac Bogoch. Thank you so much.
My pleasure.